not what the doctor ordered. A bill that would change the rules for hospitals is moving forward in Dover. Good evening, I'm Charlie Sakaitis.
And I'm Mallory Metzner. Welcome to our news at 11. We begin tonight with the financial rules for hospitals getting a shakeup.
The bill in question would create a new board that would handle financial decisions for hospitals.
While the bill's sponsor says it will help with rising costs for health care, some doctors question if this is the right way to handle bigger price tags.
Coast TV News reporter Charles Reiner breaks down the bill and shows us what it would mean for you at home.
Making financial decisions for hospitals like BB may soon be more complex.
The current process is not open and transparent.
House Substitute 1 for House Bill 350 is looking to bring a big change to the medical world by introducing a new board called the Diamond State Hospital Cost Review Board. Essentially, the board of 5 people appointed by politicians would make financial decisions for local hospitals. The bill's sponsor, House Speaker Valerie Longhurst, says the goal is to navigate the higher costs of providing health care.
You have the governor, the Senate, and the House all interested in it because every day we see our constituents and what they're going through. And the rise of health care is just, we can't make it so that nobody can afford health care in our state.
By creating a state-appointed board, Speaker Longhurst also says financial decisions made by hospitals would be more transparent for the public. But not every healthcare provider is signing off. Brian Frazee, president and CEO of the Delaware Healthcare Association, thinks these decisions that would impact local patients should be made by local officials.
If I'm somebody who is living in Delaware, I would much rather have someone in my community making those decisions based on the needs of my community versus a statewide commission that really has a one-size-fits-all approach.
Over at BB Healthcare, Dr. David Tam, who spoke about this bill in Dover on Wednesday, says he is all for bringing down the cost of doctor's visits, but worries this board would not look at the whole picture.
You want healthcare that is of great value. Value does include cost, but it also includes having access so you can go see your doctor or get your prescription or can get into an emergency room and get the care that you need, and that care is of a high quality and not just the bottom of the barrel.
The bill is now out of committee and has already been tweaked some. But before any major decisions, it needs to be considered by both the House and the Senate. The General Assembly is about to go into recess for the next 2 weeks, but Longhurst told me Wednesday afternoon that she does plan to speak with healthcare providers during that break to iron out some more of the details. I'm Charles Reiner, Coast TV News.
And this leads right into our Coast TV poll tonight. We want to know what your stance is on political oversight for hospital budgets.
Let's take a look at the updated results on your screen here. It looks like 36% support that oversight outlined in the bill. 63% want to maintain autonomy, keep things the way they are right now. Just 1% of the vote here going to budget concerns.
And this has been changing all night long. It started with more support for what is now in second place there. If you haven't voted yet, you can still go cast a vote at coasttvnews.com or use our mobile app.